As a physio, here are the top techniques that I give to people to help swelling, whether it's from an injury or from surgery. Sometimes people come to me with swelling that's related to chronic conditions like lymphedema or lipedema. This can help, but it doesn't work as effectively as for acute episodes of swelling, but it is still a really good option to give a try. To start with, I usually get people doing the big 6. I often send them the link for a follow along. We'll talk about it quickly today, but if you want to know more about it, go to the link in the description. There are 6 main points that we target. We do a sweeping motion and a tapping motion. So we always start with the left collarbone, on top and below, 10 sweeps, wherever it feels good, and 10 taps. I'm not going to continue that because I think it will pick up my microphone. Then we go over to the other side, 10 sweeps, 10 taps. With both hands, we then go underneath the angle of the neck, 10 sweeps, 10 taps. We then go into the armpit area. You would do it on both sides, but again, my microphone's here, so I'm just going to do it over here on this side. Getting into the armpit area, 10 sweeps, 10 taps. Heading onto your stomach, maybe above and below the belly button, 10 sweeps, maybe some circles, maybe up and down, 10 taps. Heading into the upper groin area, 10 sweeps, 10 taps. I usually do this standing. The last place we go to is behind the knee. 10 sweeps, 10 taps, and then jumping up and down on the spot for 30 seconds. Starting with that is a really good way to do an initial flush of your lymphatic system so that when we get a little bit deeper into things, you've already cleared up the end of that pipe. The next thing that we're going to do, going to get some kind of soft squishy ball if you have one. If you don't have a soft squishy ball like this, you can just use your own hand to do it. I do prefer the ball, but use what you've got. A lot of people on the internet swear by gorgeous balls. I think that this $10 ball that I got from a physio supplier does as good a job. The key is that it's inflatable and deflatable, so you can make it super, super squishy. If you get a ball that's permanently inflated and you can't adjust how squishy it is, it's not going to do as good a job. So we're going to get our ball and we're going to sweep it along the neck, doing a little rotation as you turn your head at the same time. So you're putting a little bit of pressure into the ball, rotating and sweeping the ball down your neck and then turning your head in the other direction. Really gentle. You're not using a lot of pressure to do this. You're just doing a gentle flush of the lymph vessels and the lymph nodes in that area. Maybe you might do 5 to 10 of these. You do it on both sides. Again, I'm not going to do it on my right side because I've got my microphone nearby. If you don't have the ball, you can use a little bit of moisturizing cream or lotion or massage cream or whatever you've got, and do the same thing with your own hand, gently sweeping down as you turn your head in the other direction. Little bit of pressure, you're not trying to hurt anything, you're not doing a deep tissue massage, you're just sort of gripping the skin lightly and then gripping the skin with your fingertips, not grabbing, and turning your head in the other direction. Not a massage, we're really just sort of flushing out vessels that lie under the skin rather than deep in the muscle system. Our next move is going to be to get the ball into your stomach, specifically into the right side of the stomach where your liver lives. The liver is really important for helping to create and process the lymph in the body, and if there's any congestion in the liver area, much more difficult to get it out of the body. Again, if you don't have a squishy ball, you can use a folded up towel. I'll show you that as well. I personally don't find it as nice, but that's okay. Use what you've got. The ball is beside my belly button on the right side of my abdominal area and below my ribs. You want to relax everything down onto the ball. You're going to take a big breath into the ball, fill up your lungs. Imagine sending that breath down towards the ball. And then once you're at the top of that breath, you're going to push your tummy muscles into the ball, hold that contraction as you breathe out, and then relax everything. So the way that really looks is like this. Gonna do that 3 to 5 times. You can do it on both sides, but when we're on the right, we're directly trying to stimulate the liver. From there, we're moving into a side lying technique, still using the ball underneath the rib area, in that curvature of your waist. Laying down onto the ball, try and relax onto it. You can let your head go down or you can rest it in your hands, whatever you feel comfy with. And just taking some big breaths, trying to fill up the rib cage and your stomach as much as you can, and then relaxing onto the ball as much as you can. So giving your guts a really big massage using the ball. You can also have it higher up into the ribs. Same thing, just relaxing onto it. Maybe you are doing some rolls side to side. Or maybe you're just doing some big breaths. If you don't have a ball, get yourself a towel, fold it up to make a little bundle, and place it in those same areas that you would have had the ball. The next technique is particularly for people who have a lower limb injury or have had surgery. If you've had a recent knee surgery, this definitely isn't for you. Depending on the knee injury, if this is very painful, you shouldn't be doing it. If you've had an ankle injury, then go for it, as long as nothing is causing any big pain here. Laying on your side with a yoga block or something about that height on its tall setting, you are going to pop the block underneath the thigh of your top leg. We want it as far up the leg as you feel comfortable going. You're going to have to play with the angle that the block is in to make it suit your body and feel comfortable in your body. You also want to move it around so that it stays flat on the ground as you're moving your leg, rather than kind of being knocked around a bit. And from there, we're going to do a few movements. The first thing is just bending and straightening that knee. The reason we're targeting this area, especially for lower limb injuries, is there's a big channel in this area called the adductor canal, where there are vessels that help to clear the lymph or the swelling from the body. We can directly stimulate the channel and the fascia and connective tissue around it. I'm just going to quickly switch to this. So we're rotating the foot up, rotating it down. For me, I just sort of felt like I had to move my leg at the time to make the block sit more comfortably. So while we can directly stimulate the channel, we can also work on releasing the fascia and the muscles that make up the entrances to that channel, some of which are the adductor muscles, which we're working on here. So bring it as far up the muscle as you feel comfortable before it hits you in the groin. You can play with the positioning, you can try out a few positions along that inner thigh. And then after you've gone higher up, you can also bring it down towards the knee. It's going to feel quite different. Rotating, bending and stretching. The last thing that we're going to do is directly stimulate the opening of that channel, the adductor canal. We can use this if you have had a knee surgery. It's a lot less awkward for someone who's post-surgical. You can use this for ankle, foot injuries, knee injuries, hip injuries. It's really great for helping to clear out any kind of fluid congestion and swelling in the lower body. But having said that, if you're having swelling in the upper body, the lymphatic vessels in your body act like a network, and if there's congestion in one end of that network, it affects what's happening in the other end as well. Which is why even if you've hurt your ankle, we still do these lymphatic techniques in the neck. So if you've got swelling, fluid congestion, not feeling great in the upper body, the hands, the wrist, the elbow, the shoulder, then doing this on the lower body is also going to help. So you want to put your hands about 4 fingers away from the middle of the knee joint. and then putting the cup on the inner thigh in there. And then from there, just kind of letting it move in the direction of least resistance. So you put it on, give it a little pull, test it in a few different directions, and then just letting it travel the way that it feels to you it wants to go. If I go up, I feel a lot of resistance in the cup. If I go down, I feel a lot of resistance, and it felt very easy to slide that way. So you're going to do that a few times. Apply it to the space. See which way it wants to go. It's kind of changed a little bit for me now. It wants to go down that way. You can just keep it on the area as well. You can do some bending and straightening with it on the area. But personally, I like to let it move, let it wander. This is a silicone cup compared to the really hard plastic and glass ones that some practitioners use. I use this a lot in treatment. I don't really use the hard plastic and glass cupping sets at all. And these are fairly easy to get your hands on. I'd finish all of that off with another round of the big six. So sweeping and tapping at the collarbone, the neck, the armpit, the tummy, the groin, the knee, and then doing a little bit of rebounding, jumping up and down on the spot if you don't have an injury that precludes you from doing that.